Okay, wonderful. Well, we really appreciate you all joining us today for this webinar. I'm Ashley Emerson. I'm the program director at Health and Harmony. In my role, I have the privilege of working with some of the world's leaders in planetary health, some of whom you'll hear from on this webinar today. Their experience and guidance are critical to stewarding our world's most precious rainforests. I'm speaking to you today from New York after evacuating the tragic wildfires in my home state of Oregon. The confluence of drier summers, hyperdevelopment along the urban wild borders, and rising emissions have led to uncontrolled flat fires throughout the Western United States. There are lots of reasons why these fires are spreading so quickly, but one of the most brilliant solutions that we're hearing is to listen to and value the wisdom of local Indigenous and First Nation communities to guide our forest management practice. We see time and time again how listening to local and Indigenous communities and adopting their solutions have the most sustainable and high impact outcomes for our climate. As COVID-19 and the fire season expand throughout the Amazon, we feel just this deep sense of urgency. The lack of access to healthcare is forcing traditional and Indigenous communities to permanently desert their ancestral lands and looking for better access to healthcare. When these families leave their lands, they're often overtaken by cattle ranchers and large-scale agricultural operations. So this partnership comes at a time when COVID-19 is not only devastating communities, but also it's really accelerating displacement, deforestation, land grabbing, and a multitude of other threats. So this brings me to why we're here today. As Health and Harmony extends our collaborative ambitions to the Brazilian Amazon, we've focused our attention on the Xingu Basin. And there we work with traditional and Indigenous communities who are the stewards of this essential tract of rainforest. The Xingu is a critical cornerstone of the Brazilian Amazon. It's a massive parcel of rainforest that serves as a green shield, preventing forest die-off, and it's a key protection of the approaching tipping point of the Amazon that we're always hearing about. What you'll learn about today from our expert panelists is a new way of approaching rainforest conservation for many of us, but for them, this is the way that has always existed. This is an efficacious model that has the ability to affect the climate crisis by drawing down vastly more carbon. And through this planetary health approach, and by radically listening to communities, together we can support the critical interventions necessary to preserve and protect this rainforest that we all benefit from. This is a place that births life, a place that is home to a flying river, which is an atmospheric phenomena so grand that your life likely depends on it. And we know that the forest fires in California and along the West Coast are affected by rainforest degradation in the Amazon. So today you'll hear from our friends at Instituto Socioambiental, also known as ISA, the Federal University of Para, and Amarere. So now I'd like to introduce you to our panelists. I'd like to welcome Assis Porto de Oliveira. Assis is an honored leader and member of the Xingu's riverine community. He's an avid fisherman, he is a Brazil nut collector, and he's president of the Association of Residents of the Rio Iriri Extractive Reserve. I want to extend a warm welcome to Dr. Fabiola Moreira. Fabiola is an agronomist with a master's degree in biodiversity and conservation. She also has a PhD in geography. Her role as assistant coordinator at ISA, she manages coordination with Teja de Mayo Cantinas network. I'd also like to welcome our friend, Dr. Erica Pellegrino. Erica is a psychiatrist with training in primary care. She's also a professor at Federal University of Para Medical School. She works with the riverine and indigenous communities in Altamira that were relocated due to the construction of the Belo Norte Dam. Erica visits the traditional communities along the Xingu River to provide healthcare, and she's the program coordinator at Health and Harmony in Brazil, where she sets up health services, establishing telemedicine, and coordinates with the university. I'd also like to welcome Dr. Kennery Webb. Kennery developed the vision for Health and Harmony as an undergraduate field assistant studying orangutans at Gunung Palung National Park in Indonesian Borneo in 1993. She graduated from Yale School of Medicine and then founded Health and Harmony in 2005 to advance the combined human and environmental work that she envisioned. Kennery is also co-founder of our sister organization in Indonesia, Alam Sehat Lestari. I also want to extend a really big thanks to our friend Tiago de Sousa Leal. He will be providing translation for today's webinar. He graduated from the Law School of University of Sao Paulo. He's an educator and has been a resident of the Xingu since 2017. And I also want to give a big thanks to Trina Noonan, Kristen Grauer, Emma Sutton, Devin Schmidt for all your support in today's webinar. And lastly, a very special thanks to our friend Marcelo Salazar. He is somebody who's been instrumental in this initiative and has spent many years building trust and supporting the communities in and around the Xingu Basin. And through his support, we've been able to extend this relationship at such a critical time. So if we are all set, Fabiola and Assis, I'd like to jump into our first question. And Assis, I'd love to begin with you. So my first question is, if you can share with us what your relationship is to the Amazon and how the rainforest and your relationship has changed in recent years.
Ok, seu Assis, está me ouvindo? Faz sinal de joia se estiver me ouvindo, seu Assis. Seu Assis? Joia, está me ouvindo? Ok. We had a minor setback here. I would like to ask you to repeat the question, please, so I can translate it after. Sorry.
No problem, Tiago. So Assis, my question is, what is your relationship to the Amazon, and how has the rainforest and your relationship to it changed in recent years?
Então, seu Assis, qual que é a sua relação com a Amazônia e como que essa relação com a floresta tem mudado nos últimos anos?
Perguntando qual é a situação da Amazônia hoje.
Tá me ouvindo?
O que mudou nesses últimos anos?
Tá me ouvindo agora? Todo mundo?
Estamos te ouvindo,
então,
seu Assis.
A minha relação com a Amazônia e o que mudou nesses últimos anos está muito bem explicado, tá fácil para mim fazer a explicação. A minha relação com a, incrível que pareça, ela é uma região muito grande que tem no Brasil. E, para variar, eu consigo morar num trecho da Amazônia que é na Terra do Meio. A Terra do Meio, ela é localizada na bacia do Rio Xingu e é um dos grandes trechos da Amazônia onde a gente consegue ter floresta com suficiência. Então, esse é um privilégio que eu tenho de conhecer a Amazônia e ser morador da Amazônia, amigo da Amazônia, filho ou pai da Amazônia. Um pedaço de mim é a Amazônia e eu, um pedaço da Amazônia, eu sou. Inclusive, eu sou o guardião da floresta e desde 57 anos de idade que eu tenho vivendo naquele lugar. E a mudança que teve na Amazônia, no meu entendimento, foi as grandes queimadas que avançou bastante nos últimos tempos e feriu bastante a Amazônia e ela chorou o fogo. Essa é a mudança que eu entendi na Amazônia dentro desses períodos de anos de que ela era antes e do que ela é hoje. Ela hoje chora debaixo do fogaral que tem na nossa região. Essa é a mudança. Mas o mais está tudo certo, está tudo bem. A minha relação com a Amazônia, e é o que eu sei falar da Amazônia, é isso.
Alright, ok, Sucis, eu vou passar agora para elas, tá bom? Mr. Sucis emphasized that the territory is very big, it has many places and regions, and he feels privileged to live in one of these territories, which is the Middle Land. He feels he is very part of the rainforest. He feels like his family, father, son, all of those ties, he emphasized that. And he is being there, enjoying this conscience of being united to the rainforest for some years already. And regarding the changes, he is noticing that the most dramatic ones are the recent fires that are ravaging the rainforest. He feels that the trees, the land are crying under fire.
Obrigada, Aziz. Fabiola, I'd love to ask the same question. What's your relationship to the Amazon, and how has the rainforest and your relationship to it changed in recent years?
Fabiola, tá me ouvindo? Fabiola?
Sim.
A pergunta, então, é a mesma para você. Qual que é a sua relação com a floresta?
Sim.
E como isso vem mudando nos últimos anos? Tá bom?
Qual a situação da Amazônia e o que mudou nos últimos anos, né, Thiago?
Isso, sua relação com a floresta e o que isso tem mudado nos últimos anos.
Você está ouvindo?
Sim, tem um pouco de atraso, mas a gente está te ouvindo. There is a little bit of delay, but yes, you can hear her well.
Yeah, we can hear her well. It's nice to hear you,
Erica, vocês
Fabiola.
me
Thanks
ouvem
for
bem?
sharing.
A gente está te ouvindo bem.
Então, nos últimos anos, o que mudou muito na Amazônia, principalmente, houve todo desmonte, né, principalmente nas políticas de proteção territorial e de direitos básicos dos povos e das populações que vivem nessa região. Então, nos últimos anos, o aumento do desmatamento, o aumento das pressões sobre territórios protegidos foi algo que mudou significativamente aqui na Amazônia, na Terra do Meio. A gente viu essa população estarem sendo cada vez expostas às inseguranças, né? E também seus direitos básicos como saúde, educação, segurança territorial violados, né? Então, essa questão da opção territorial, essa pressão sobre os territórios, populações tradicionais, foi algo que tem mudado muito ao longo dos anos na Amazônia. Tem cada vez mais fragilizado o direito desses povos e que também acaba afetando principalmente, ameaçando principalmente a permanência dos povos e populações tradicionais nos territórios.
E eu vou passar para elas agora. So, Fabiola says that in the recent years, what she feels as the most dramatic change is the changing the public policies in protection and the people's rights. There's been an attack in the structures that should protect them. So aside with deforestation, there are lots of pressures, a lot of pressure that expose traditional people, traditional communities to many forms of insecurity. They don't have guaranteed the rights on healthcare, on education, and mainly the right to remain in the territory. They are exposed to a very fragile, a very precarious situation that threatens their very permanence in their lands. So this is what she understands is the most dramatic change in the recent years.
Obrigada, Fabiola. These are challenging and concerning changes that we too see from here, and hearing about your experience and your reflections is so helpful. Thanks, Aziz and Fabiola. Erica, we would love to ask you the same question regarding your relationship to the Amazon. What brought you there, and how has the rainforest and your relationship to it changed in recent years?
Hi, everyone. I'm living here in the Xingu region for 3 years now. I came here the first time because of the human health violations, human rights violation from Belo Monte Dam in Stelling. It's the second biggest dam. It's a huge project here that displaced a lot of people. And this displacement is, it has an ethnical and way of living violation as well. And it touched me a lot to be with those people and everything they were struggling to keep, their way of living that's far more sustainable than ours, and they were losing it because of these development projects. So I came here to the Amazon in this scenario of violation, and in those 3 years, it just got worse in some senses, like with our government now and the fires and everything. But we are. It's very inspiring to be with this population and working together with them and the organizations that are doing this work to do something about it and try to preserve and conserve this way of living. And for me as a health professional and a mental health professional.
Wonderful, Erica.
Erica, do you want me to translate you, or would you mind just...
Não,
no. Okay.
O que eu disse foi que eu vim para cá faz 3 anos e que eu vim por conta da questão das violações de direitos humanos que aconteceram com a instalação de Belo Monte. E fiquei muito tocada e inspirada pela maneira como as pessoas viviam em relação, como elas resistiam, né, em seus modos de vida, nas questões étnicas, culturais, que é um modo de vida muito mais sustentável do que esse que justamente acaba deslocando elas e violando seus direitos. E que nesses últimos 3 anos esse cenário de violações só tem se intensificado e piorado. Então, eu só estou traduzindo. I'm just translating to Portuguese, so Fabiola and Assis can also join the conversation since they don't get English very well. E aí, por isso, a gente tem esse... aí, assim, eu sinto que isso veio piorando nesses últimos anos e que trabalhar junto com essas populações e com as organizações que trabalham junto com elas também tem sido importante para mim como uma maneira de lidar com isso tudo.
Great, thanks, Erica. So again, my next questions are really for Fabiola and Assis. And my question, Fabiola, if we can begin with you, is we understand the communities and the Xingu are facing many challenges, including the impacts of the pandemic and COVID-19. Can you share with us more about this?
Fabiola, se a gente puder começar com você, você poderia falar para a gente reconhece, né, os desafios todos que estão acontecendo, mas a gente queria falar especificamente como que está sendo o impacto da Covid-19 por aqui. Você poderia falar um pouquinho disso, por favor?
Eu não sei, Thiago.
Tudo bem?
Porque é crítico, a Amazônia e todo o planeta, essa conta?
Oi? Fabiola, está me ouvindo?
Tiago, maybe we can begin with Assis with the question, if he can hear us okay, and we can come back to Fabiola.
Ok. Seu Assis, o senhor está me ouvindo? Seu Assis, liga o seu microfone. Liga o seu microfone para conversar um pouco com a gente, seu Assis. Abre o seu áudio.
And thanks for bearing with us through the technicalities of hearing these really important voices.
Seu Assis, tem um botãozinho de microfone embaixo, à esquerda. Isso, foi.
Então, seu Assis...
Eu já fiz de tudo aqui para melhorar o som, mas consigo ouvir tudinho direitinho, mas
Tá, então,
tem
senhores,
dificuldade.
Seu Assis, só para voltar então à pergunta. A gente solidariza e reconhece todos os desafios que os povos aqui da Amazônia estão enfrentando, mas a gente queria saber do senhor como que está sendo especificamente a questão da Covid aqui na região. O que o senhor pode falar para nós, por favor? Tudo bem a pergunta? Vocês?
Mas eu não estou ouvindo. É o que eu estou falando, eu estou tendo dificuldade para a questão da Covid na região do Xingu, num contorno geral, ou da Resex? Geral?
Se o senhor pode falar elas não especificaram, então se o senhor quiser falar
do
um pouquinho.
Xingu, acho que é mais do Xingu
eu não consigo,
e das
Thiago,
Resex.
ouvir de fato o que vocês estão dizendo. Se estiverem me ouvindo, o que eu estou percebendo da pandemia é uma situação muito grave hoje, no primeiro momento. Muitos casos e o isolamento social na nossa região, ele não funciona. Inclusive, a gente podia e deveria estar bem protegido lá nas Resex, mas às vezes tem pessoas que se baseiam o modelo da cidade com o nosso dia a dia naquela distância que a gente está, que é um dos pontos que mais é uma teclas que mais eu bato como diretor, como dirigente ou como presidente lá da associação, é conscientizar a população que está ali, que é diferente uma reserva extrativista de um município, de uma cidade grande tipo Altamira. Então, isso também está ajudando na prevenção, porque tem gente que está se conscientizando que o momento é de ter cuidado para se prevenir dessa pandemia. Com as ajudas e as ações que hoje está acontecendo lá, também está motivando, porque são coisas que eu vou colocando no dia a dia, na vida das pessoas, dizendo, olha, pessoal, existe um programa aí funcionando, um povo articulado, dando todos os apoios que existe do mundo para que nós possa ficar prevenidos nessa pandemia. Então, vamos fazer o nosso melhor também, vamos fazer a nossa parte e, enfim, de qualquer forma, mesmo ainda na minha avaliação, deixando a desejar, mas está acontecendo sim a prevenção, com as ajudas, com os apoios, com esse projeto de saúde e harmonia que também nos contemplou muito, ajudou muito no atendimento. A gente, de uma forma ou de outra, tem que conscientizar que está sendo atendido, sim. Só procuramos melhorar mais um pouco o atendimento, porque nunca a gente chega num ponto de dizer assim, a gente já está aqui consolidado com tudo que aconteceu. Não é bem isso que eu estou dizendo que está sendo sim atendido, mas precisa ainda melhorar o atendimento, que no dia a dia a gente sabe que a gente vai conseguir melhorar esse atendimento de saúde. É isso que eu entendo, que eu vejo a pandemia na nossa região. Meu análise é esse aí.
Ok, Sr. Assis, obrigado. Eu vou traduzir para elas, tá bom? Assis said that the situation about the pandemic is very severe. They have many cases. The isolation, the social distancing is not as effective as it should be. There is some confusion among the people because they receive lots of instructions based on the city lifestyle, the urban lifestyle, and this doesn't work. Just doesn't work there. as a leader, he emphasizes these differences, and he tries to focus on prevention. He believes that this helps people to understand the situation, to inform people, and mainly, also, it's very important that the external help takes part of it. He mentions the international support, especially Health in Harmony, and he says that this support is something important to make people realize that if on one hand they are receiving medical support by Health in Harmony, for instance, it's their duty to meet their part of the deal, so all of us could work together better, could work better together. He points out that it's a very welcome help, this healthcare, even though there's still room for improvements. That's it.
Thanks so much, Assis. It's helpful to hear more insight into what's going on as we've seen the COVID-19 pandemic bring many layers of devastation and challenge to communities. And Fabiola, I want to ask you the same question. We understand your communities are facing many challenges, but if you could give more insight into the COVID-19 pandemic and how it's affecting communities.
Fabiola, você nos ouve agora? Abra seu microfone. Sim. Ótimo. Então, a pergunta é a mesma. Como que tem sido o impacto da Covid-19 recentemente? Como você enxerga isso?
Não estou te escutando, Thiago.
O impacto da Covid-19, como tem sido na região, como você entende que tem sido esse impacto? Entendeu?
Desculpe, Thiago.
Mais uma vez, está me ouvindo agora? Não?
Você me ouve, Fabiola? É só o Thiago que você não está ouvindo ou é ninguém? I think she's not hearing anyone.
Estou te ouvindo.
Yeah, and we apologize for all the technical difficulties. It's so tricky to do this kind of thing between across countries, multiple languages. We had some techniques worked out, but they seem to have failed, so.
And yeah, this is just sometimes what happens. I think in the meantime, Fabiola, I'd love to come back to this question in a bit, but in the meantime, Kennery and Erica, I want to direct the next question toward both of you to share with us this unique collaboration that we're speaking about today and what our objectives are, speaking about ISA, Health in Harmony, Amarere, the associations, and the Federal Medical University. Kennery, do you want to kick us off?
Yeah, so I'll start with just giving a little bit of background. So over the last few years, Health in Harmony has been realizing that we wanted to test this model that was so wildly successful in Indonesia, in other parts of the world, and see if it would work as well there. So the situation in Brazil is a little different. There are traditional and indigenous communities who live on the land and who protect it. But there are many threats to them being able to protect it, as you have heard. So last year we did an assessment. I was blessed to be able to travel with Noor, one of our other staff members. We went to the Amazon. We traveled around much of Brazil looking for a different context and beginning to understand the situation there and looking at potential partners. And it was very clear, as you have heard, that the shipping is just one of the most important parts of the Amazon. It is under the greatest threat. And if we lose it, we're likely to go over the tipping point where we'll lose the entire Amazon. So that is just unbearable and would would be extremely serious for the survival of the planet. So these people who are living there are some of the most important people on the planet. Assis, who you're hearing from, he lives in these communities for many generations, and he and all of his friends and the groups that are protecting this forest, very small number of people, but the amount of forest they're protecting is enormous. It's the size of the UK. And we are so grateful to them for what they are doing for this planet. And they are under great threat. And the greatest threat that they are under right now is related to COVID. Now, of course, their healthcare when we visited last year was atrocious then. But with COVID, that's just makes it much, much worse. So we have been just so blessed to have the most incredible potential partners. And we are very surprised because we thought because of COVID, we would not be able to begin this year in the Amazon. But partnering with ISA, it has been possible. And then we were able to hire Erica, this incredible physician. And so she's been helping us. She also works at the medical school, the local medical school, who've also become partners with us. And that has allowed us to begin to meet the needs of the communities. So I'll just explain what happened when we first started. So we do radical listening. That's our whole thing. Now, how do you do that when you can't actually go visit the communities? We'd of course been there the year before and talked to many people, but we hadn't done this kind of formal process of listening to the whole communities. But because ISA has this long-term relationship with which turns out Hello, who is the head of ISA via the shortwave radio about what would you all need from the world community so that you could rainforest. Ashley was telling you about these rivers in the air that actually provide the water that makes the rain in California. Like we are all connected in this. And so we asked them and it was pretty, you're seeing this technical difficulty. Well, let us tell you, it was like a whole nother layer of interesting technical difficulties, but we managed to pull it off. And we, through the shortwave radio and asked communities, we had 6 different meetings with the traditional extractive reserves. These are communities who have lived on the land for many, many, many generations. They've learned a lot from the indigenous communities, and they protect the forest. We will also soon be doing meetings with the indigenous communities. That's slightly more complicated because it needs to be in the indigenous languages and it will need to be in person. So we asked all these communities what they would need, and the answers were very, very clear and completely consistent across all of the communities. They needed better access to healthcare. They needed they already are very happy with the work that ISA has been doing on livelihoods and helping them get higher prices for many of the wonderful products they collect from the forest, but there were a few little things that they wanted to improve. And then they also wanted education advocacy. So in the healthcare realm, the specific needs that they asked for were help with evacuations. Particularly during COVID, this is a very, very serious problem. There was, for example, I'll just tell the story of an amazing man who was one of the founders of one of these reserves, an elder. He got COVID. He traveled very, very, very slowly out, staying with over 10 families, and probably exposed them all to COVID. So a way for him to have been able to fly out or to have a boat ambulance that could have quickly brought him to the city, and healthcare would have been very, very important. So these are and unfortunately he did die. These are the kinds of stories that we don't want to have happen. They also asked for nurses to be stationed in the communities, and they also asked for like solar panels at the nurses' stations, and they asked for these expeditions 3 times a year of physicians who would be able to go into the communities and provide care. And that's extra important now that COVID has reached many of these remote areas. So Erica, I'm going to pass it over to you, and maybe you can talk about one of these expeditions that you're organizing to leave very soon, and also about our wonderful partnerships with all the different organizations. So.
Excuse me, Fabiola would like to comment now, if possible, just before Erica.
We were planning.
Erica, if it's okay, yeah, we'll turn it over to Fabiola to share her insights into the impact of COVID-19 on the communities. Thanks, Thiago.
Great.
Então, eu queria comentar também um pouco, né, sobre o impacto da Covid nas comunidades. A Mira já tem muitos casos de Covid, já são mais de 11 mil de Covid na cidade. E foi extremamente importante, né, das populações, das resex, dos povos indígenas se mantessem nas comunidades, ao lado. Esse atendimento, né, esse atendimento que veio via telemedicina foi extremamente importante, inclusive, para que essa estratégia de isolamento, de manter as comunidades, as ativistas, né, seu Assis, os indígenas nas suas comunidades, nas aldeias, foi extremamente importante para que tudo isso desse certo, né? Porque através do atendimento, do teleatendimento, né, mantendo essa parceria aí com a Refiarm, com a Universidade Federal do Pará, com a Faculdade de Medicina, né, com a Moreri, com a TNC, com todas essas pessoas que envolvem o trabalho aqui, foi extremamente importante porque a gente conseguiu agilizar esses atendimentos por meio da telemedicina, diminuindo a exposição desses povos e das populações à Covid na cidade, né? Diminuindo a necessidade de que essas pessoas tivessem que vir né, aqui para a cidade para ter um atendimento de saúde. E estrategicamente importante foi a questão das próprias cantinas, né? A rede de cantinas da Terra do Meio, que a rede se preocupou em manter as cantinas minimamente abastecidas e a rede funcionando normalmente, com as mini-usines funcionando, produzindo. Então, uma garantia também para que as populações pudessem se manter em seus territórios, produzindo produtos florestais madeireiros, e gerando renda nessas comunidades, tem uma renda lá, tem acesso aos itens básicos através de cantinas, sem que houver necessidade dessas pessoas estarem se deslocando para a cidade de Altamira e assim se manter em isolamento. Então, essa estratégia de ter uma assistência à saúde através da telemedicina e a estratégia também de manter a rede de cantinas funcionando se mostrou muito eficiente. Então, desde o início da pandemia até as últimas semanas agora do mês de setembro, não havia casos de Covid confirmado em nenhuma das unidades de conservação, das resex que a gente fala. E o primeiro caso a gente teve foi há 2 semanas, mais ou menos, de confirmar, né, seu Assis? E, infelizmente, a gente teve a primeira perda na semana passada, foi do Piquion, né, Chicrim, qual lamentamos muito o acontecido. Então, a estratégia de telemedicina, com a ajuda de economia floresta por meio da rede de cantinas, foi extremamente importante nesse momento para que as comunidades pudessem manter esse isolamento, né, produzindo e tendo tendo essa tranquilidade de precisar vir à cidade e se expor à Covid-19.
Fabiola was saying that while in the region here we had a very dramatic condition of COVID in the extractive reserves, thanks to the multiple support of so many institutions with telemedicine, the help of the university, the help of Health and Harmony, and other partners, we could here avoid exposition of the population of these reserves. They had not the need to seek out healthcare in the city, and together with the strategy of telemedicine, it was also of vital importance the maintenance of the cantinas network. The cantinas are the hubs they have to store and distribute the goods of non-forest timber products. So this network remained functional, so people could keep their economic activities and secure their incomes. And this also ensured they could remain in their territories without the need to come to the city. This has proven to be a very effective strategy, because up to 2 weeks ago, there were 0 cases of COVID, at least the registered cases. So the first case that was tested positive was 2 weeks ago. And just recently we had our first loss was the indigenous chief. It was named Onça. It was a very grievous situation for us all. But she emphasizes on the success of the strategy of keeping people isolated from the city due to the combination of these two tactics of providing telemedicine with all the support that it involves, and to keep the network of the hubs functional, so people could ensure their economic activities and income.
Obrigada, Fabiola. We can hear in her response the multi-layered challenges of health and economics and travel, and what it takes to take care of your families in so many ways during the pandemic. Erica, I know you have been working hard on how to address some of these challenges. As Kennery mentioned, you're working on health expeditions, bringing teams up into the Xingu, but also collaborating with ISA to focus on some of the economics of these challenges. Do you mind sharing a little bit more with us about that?
Yes. So as a mental health professional, I thought that I would work especially with mental health. But when you get to communities that have no access to health at all, you just have to address general health. And health is not only a matter of the biological body and this kind of, and how disease works. It has its environmental and social determinants. So we cannot address to health of this population in a disease-based approach. We have to approach their issues in their own terms, in their own way of living, and provide, this is our objective, like the background that Kennery shared with us, that this population, they have a way of living that preserves the forest, which is so important for all of us, and giving them access to health, not only providing medication for disease, but understanding that health is part of well-being, well-living way of being in their land and being able to be there with their family and be with the forest and live from the forest. I think this is why we need not only interdisciplinary, but we need a lot of institutions that work with these different aspects. So we need the university helping us to get indicators about the environment and about how people live. And also we have the medical school and people that live here and can be here after they graduate, and we get more doctors here. We have ISA, Instituto Socioambiental, that has like socioambiental means social environmental. So we have, this is a single word, so it comes together. We can't, I don't know if it's, we can like address to some of the question and answers right now, but someone asked about how can we differentiate the anthropogenic and natural changes. And I think this is not that simple. I think the way our society, Western society sees the world has this separation, but the way traditional communities live in the world, it's not separated. Like Amazon today is the more important system to get carbon and keep the climate in a bearable and livable way for the whole world. And the Amazon has, we have this phenomena in the Amazon forest that hyperdominance of species. So we have a lot of evidence that the forest is anthropogenic. So people, traditional indigenous people selected some species over millennia. And so the forest is not a natural place where people live. Traditional communities, they made along the years the forest to be how it is and to be capable of getting so much carbon in some way. So it's interesting to think about that in that way, that we have to provide health together with sustainable way of living, production. How can people live from their way of living, getting products from the forest, fish and everything, and how the global community can help to keep this standing.
Great, thanks so much, Erica. It's really helpful to hear more about this collaboration and your perspective on climate change, and specifically these anthropogenic changes, where, as you shared, this phenomena doesn't always exist within the communities in which we honor and work. There's a deep interconnection between the forest and people. So thanks so much for that. The next question that I wanted to ask is how this work will impact the climate crisis. We know that the Amazon is so critical to drawing down carbon and addressing global heating, but Erica, from your perspective, how will this shared work impact the climate crisis?
Sorry, can you repeat the question, the last part?
Sure. So the question is, how will this shared work impact the climate crisis?
Okay. So we have this phenomena of land grabbing in Brazil that's getting all the forest. We had like in middle of Brazil, near where is Brasilia, our capital now. We had a lot of forests down, and it's now everything it's like for cattle and for soya beans. It's like a lot of huge plantation, and that's like the way this business, agribusiness works here. It's very disastrous for the environment. And one of the things that helps that prevents this happening here in the Xingu region right now, it's the way of these communities. They organized themselves in the last decades, and they fought for their right to be in the land, and they got this recognized politically, like they are belonging to the land and their need to be in the land and had it protected because they live from the forest and from the river. It's not like they go and buy things in the supermarket and they can live in just a small house like people in cities does. So this different way of getting these community lands in Brazilian law, people can't get it registered in their individual property. So I cannot buy a land there. And neither Mr. Assis can buy a land there. He is part of the community that's part from the forest. And this is under menace with this government. So if we, with this partnership, we can help those people to stay in the forest and have this political impact in remaining a place that cannot be bought or sold. And that's what land grabbers do. They just like get some piece of land and burn it all, and then they sell it with fake papers, and they have this intention in over years to get this legalized, and it can't be done in these lands from these communities. And if they don't have ways of having education, health, and be strong as a community, they will just end up living to live in the town. So we have a journalist here that describes this process, like having rich people from the forest, because they are rich in the forest, to be urban poors, be transformed into urban poors, and then we don't have those people there standing for their land, and we will end up losing a lot of Amazon because of that.
Thanks so much, Erica.
And just to add, when we were in the forest and talking with many people, it was just really powerful to hear how terrified people were of not having access to healthcare, and how many people told us it was the greatest threat to them staying on the land. Not that and education, but one woman said to me, well, health is number 1, 2, 3, 4, and 5, and then education is number 6, right? She said, without having access to healthcare, it's very hard for us to stay on our land. So,
yeah. And as of a few weeks ago, Health and Harmony, in collaboration with ISA and Honorary, has launched an emergency medical response in the Xingu, as Kennery and Erica have described, bringing in medical supplies, medical professionals, setting up telemedicine, and an effort to extend more sustainable efforts to help prevent future shocks like the COVID-19 pandemic. Okay, I'd like to turn things back over to Assis and Fabiola. And the next question that I have for you is from our audience. And a reminder, if you have any questions, feel free to drop them into the Q&A box at the bottom of your screen. But Fabiola and Assis, whichever one of you would like to go first, my question is, what gives you hope? Tiago, can you hear me okay?
No, yes, they are opening the mic.
Great.
O que dá esperança de ver aqui? Me dá esperança de ver aqui, ter a certeza de que a gente já tem programa que está funcionando, que é o Projeto do Céu e Harmonia, apoiando todas as atividades que existe lá no executivo, como o Fabíola tinha dito. Isso é que é, para mim, viver qualidade na minha comunidade. Então, nada mais do que isso, a gente conseguir ter os projetos em andamento e ter a certeza de que eles não vão parar e vai continuar apoiando na saúde, na educação, no alimento, na parte produtiva e na ajuda à prevenção da Covid-19. Isso, para mim, que é esperança de vida boa para o futuro.
Okay, I will translate now. What gives him hope?
A gente, através dessa parceria, né?
Fabiola, deixa eu traduzir primeiro o seu Assis, depois você fala, pode ser?
Oi?
Eu traduzo primeiro o seu Assis, depois você fala, pode ser?
Claro.
Tá, só vou traduzir ele aqui, depois você fala, tá bom? Mr. Assis finds hope in the partnerships, in the projects that are going on, and the continuation, the continuated support, that all of these working together, the partnerships, the projects, the support that comes even from abroad, it helps them getting healthcare, food security, production of non-forest timber products, and the prevention of COVID-19. Now, Fabiola, pode ir, Fabiola. Fabiola, pode falar agora.
Fabiola, can you hear us okay?
Fabiola, tá tudo bem com seu áudio?
Fabiola, você está me ouvindo?
Oi, Era.
Você pode falar agora, o Thiago terminou de traduzir o seu Assis, eu acho que você não está ouvindo ele.
I think we're having some trouble.
Sounds like she can't hear us.
Erica?
Oi, está me ouvindo, Fabiola?
Não.
Está ouvindo?
É a mesma pergunta, assim, mas pode responder.
Oi, vocês estão me escutando?
Sim.
É que está caindo um pouco, a internet está bem, tá ruim, gente, desculpa. Mas até ressalto um pouco que a Erica falou anteriormente também da importância da Amazônia. Mas acho que tem uma coisa também realmente importante, que é a importância do Xingu, né? Essa região onde a gente está vivendo, onde a gente vive, onde o seu Assis, né, o seu Assis criou e o trabalho há anos das populações, que o Xingu, ele tem duas biomas importantes, né, as ramas, não é? E nesse momento, nós, assim, os maiores desmatamentos dos estudantes, então, a gente teve um dos maiores índices nos últimos 10 anos de desmatamento, e isso é extremamente crítico, uma região extremamente importante, onde tem mais de 50 milhões de hectares, mais de 20 terras indígenas aqui na Baía do Xingu, 10 unidades de conservação, cerca de 28 milhões de hectares só em áreas protegidas e terras indígenas, né? Sem falar que aqui estão centenas de famílias ribeirinhas, como a do Assis, como de várias pessoas que moram nessas cidades de conservação, e mais de 26 povos indígenas, né, que vivem na bacia do Xingu. A gente está falando de uma das áreas mais importantes do mundo, né, do planeta. Então, como disse o Assis, que aqui do meu lado, né,
Coração do mundo, a bacia do Xingu.
Onde a gente tem a sociobiodiversidade comparada, como a Erica falou, a gente não tem como separar o social do ambiental, né? Acho que a gente tem aqui em Xingu um dos principais exemplos disso, né? Então, o que nos dá esperança é ver que a gente acredita que esses povos vão conseguir existir, apesar que, nesse momento, os seus jeitos básicos, como a proteção dos seus territórios, tem sido uma das grandes preocupações, né, Celso?
Muito violado.
Então, mas acho que o que dá esperança para acreditar é que a gente tem parceiros, tem principalmente as comunidades dentro dessa parceria, né? E saber que junto a gente vai poder dar esse cenário, né? Resistir a esse cenário, né? Os povos já resistiram a muitas coisas aqui no Chile, já resistiram a um monte. Infelizmente, os impactos não são, mas a esperança é que a gente trabalhado juntos, unidos aqui.
Thiago, you're muted.
Sorry, Fabiola, wanted to emphasize some figures to illustrate what gives her hope. She was very emphatic to give some numbers. Like in the region of Xingu, we have over 50 million hectares, more than 20 indigenous lands, 10 conservation units. About protected areas alone are 28 million hectares. We have hundreds of people living in the extractive reserves and 26 indigenous ethnic groups. So she considered that this huge social diversity makes this area one of the most important in the world, and they consider it to be the very heart of the world. That's why it's utterly impossible to separate by any means social and environmental. That's why what gives her hope is that she believes in these populations, even though they are under such heavy threats in their basic rights. It gives her hope, the fact that we have found partners, we are finding partners that help us in this resistance. And mainly the fact that communities themselves, they are organized in these partnerships and in this resistance. She believes that together we can do much, especially because people in the Xingu, they have already suffered many impacts. She mentions the heavy impact of the Belo Monte to them that brought many harm, but still they can guarantee their union, their organization in order to resist. That's it.
Obrigada, Fabiola. It's very insightful and helps us really see how dynamic and important this place is. It certainly gives me hope hearing your response, and you too, Mr. Aziz. So we've had some great questions. Not all of them we'll have time to get to in this webinar, but we would love to follow up with some of the questions you all have shared. Before we close up in the next few minutes, I'd like to ask one more question to Aziz, which is, why is the forest important, and what wisdom can you share with our audience?
Sorry, could you repeat? It was a little bit choppy here.
Sure, Thiago. So the question for Aziz is, why is the forest important, and what wisdom can he share with us?
Why is the forest important? And the second part, please?
The wisdom that he can share with us
All
to
right.
send us on our way. Yeah.
A floresta é importante de uma maneira todo mundo que é devorador quer ver o que ela. Então, já mostrou que ela é importante. Quando negócio, objeto, não tem significância, não é importante, ninguém liga para aquilo. A floresta, ela é muito importante. Então, você vê que toda pessoa quer chegar para ela de uma forma ou de outra. Nosso, né? Filho dela. A adaptação com ela, estamos em um pensamento de protegê-los. A gente sente verdadeiramente guardião da floresta. E outros quer perseguir para desonrar a vida, o coração do mundo. A floresta é o pulmão do mundo. Sem floresta, o que seria o resto do mundo que estiver por aí? Que tudo depende da floresta. Então, a floresta minha é isso eu vejo a floresta. Porque eu habito ela, eu não tenho como pegar a floresta, porque eu nasci na floresta. Sou filho da floresta. Tenho 107 anos morando na floresta. Então, para mim, a floresta é tudo. A vida, o coração do mundo, o pulmão do mundo, e sem floresta não tem como ver. Por isso é que a gente acha importante o algo aconteceu da maneira que está. A gente vê que tem os emissários, mas tem o outro time favorecendo apoio e ajudando a gente a manter a floresta. Para mim, é isso que a floresta significa. Sabedoria e a sabedoria. A pessoa, quem, a idade que eu tenho, vivendo no lugar onde nasci, onde meus pais criaram, ter floresta lá do mesmo jeito, isso a minha sabedoria, que todo povo do mundo é preguiça. Ser um homem preguiçoso vive na floresta e não faz nada. Então, o que a gente faz na floresta é de grande importância, para nós mantermos o fogo de vida para nós e para quem está no mundo todo. Isso é muita sabedoria.
So, Asias says that the importance of the forest can be measured by how so many people are interested in exploit it economically. He says that anyone who is a devourer wants to devour the forest too. But we, the children of the forest, we have another way of thinking. While others want to pursue and devastate the forest, we believe it is the lungs of the world. Without it, what would be of the rest of the world? I do not deny the forest because I was born in it. I lived in there for 57 years in my life. I consider it to be not only the lungs, but the heart of the world, and we cannot live without it. Although we have opponents that want to take it away from us, we still unite so we can defend this land, which is our home. That's why I believe the wisdom is to know how to live, to respect the soil we were born in, to live and keep the forest where we were born. While this is considered by others as a sign of laziness, to us is a sign of respect. This is to live in accordance and in harmony with the forest. That's it.
Obrigada, Mr. Aziz. That was beautiful and a really important note for us to close this webinar on. I want to thank all of our panelists, Dr. Kennery Webb, Dr. Erica, Dr. Fabiola, Aziz, and thanks so much, Thiago, for your translation. It's been wonderful to hear your voices, to hear the work you're doing, and we so appreciate everything you're doing to care for our planet. So what we hope you take away is understanding the urgency at which we're operating, the creativity that the communities have in addressing these major challenges, and the hyper interconnected solutions from communities, which are essential to our collective future. I want to thank you all on the webinar for your time. I want to thank you for your continued support and for joining us today. And I just want to offer a few closing thoughts for how you can continue to make an impact for rainforests today and beyond. So first, know that there's hope. If we can continue to partner with Indigenous and traditional local holders of wisdom, we have a better chance of supporting all life on this planet. We also ask that you please sign up for our newsletter at healthandharmony.org and share social media posts with your community. It's a great way to share the voices from the Xingu. And also a way to say thank you to these communities so they can steward rainforests like the Xingu is to donate to Health and Harmony. And so visiting us again at healthandharmony.org is a great way to do that. I want to thank you all. Please be well, and please remember to vote early if you can. Take good care. Thanks so much.